Hi, I'm Dr. Jha from Renew Clinic in Leamington Spa. Today I'm going to talk to you about a common condition called ingrowing toenails. Lay people also call it ingrown toenail. Both are same, where the nail tissue digs into the tissue of the big toes generally. It could be any side of the big toe, and it is a painful condition, and there's a continuous trauma, and it is generally linked with somebody wearing pointed shoes where there is a very little room inside the shoe, and there's an overcrowding, and that can lead to deformity of the nail, and that can grow into the tissue, producing what we call ingrowing toenail. So therefore, to avoid getting an ingrowing toenail, one should wear footwear which is quite wide, or maybe is open, or maybe a flip-flop, etc. Now, the ingrowing toenail is, as I said, is a painful condition, and in the early stage, there may not be any infection, but if it is left untreated, generally it can get infected at some stage, where the part of the toenail and the surrounding tissue become red, inflamed, and very, very tender to touch. And sometimes if the infection persists, or there's a recurrent infection one after another, which can happen, it can lead to formation of granulation tissue, which is a pink fleshy tissue growing between the nail and the surrounding tissue. And they are quite friable, they tend to bleed, and it's a nuisance to manage. So if you got this, then seek the help of your GP, see what you help and support you get. Failing that, you can always contact us at Renew Health Clinic, and if you have granulation tissue, we generally burn it off with either laser or surgical device. And then the infection will be controlled with the help of antibiotics. But during the post-operative period, we advise you to wear loose-fitting footwear and keep your foot raised, because there's a massive tissue swelling there, and because of the tissue swelling, the infection tends to prolong and the healing is poor. So rest and elevation would be very helpful in such situation. The actual treatment of ingrowing toenail is, of course, either partial excision of the toenail or complete excision of the toenail with ablation of the nail bed. That is a standard treatment offered across the world, anywhere you go. So if you have an ingrowing toenail, seek the help of your local doctors. Even local podiatrists can help you and see what you get there, help there. And if not, you can always come back to us. Thank you very much.